Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. My guest this evening is Dr. Angela Marshall, President of the Montgomery County Medical Society. My guest this evening is Dr. Angela Marshall, President of the Montgomery County Medical Society and a noted internist practicing right here in Montgomery County. Angela, welcome to Housecall.
Thank you for having me. I'm happy to be here.
My pleasure. So briefly tell our viewers about your professional background.
Yes, thanks for asking. So I'm a physician by training, but I actually started my career as an electrical engineer. And long story, which I won't bore you with the details, but as such, I have practiced in Montgomery County for the past 16 years. I've practiced for a total of 22 years. And I am an avid techie, okay? So I love technology and I love using technology to help solve some of the problems of healthcare. More than that, I love my patients.
Good for you. That's a formula for a very happy and successful physician.
Thank you.
Briefly then, tell us how you came to become president of the Montgomery County Medical Society. That's very impressive.
Well, yeah. Well, so I was I've been a member for about 15 years or so. And shortly after becoming a member, I'd say maybe 5 years in, I joined the board. And I found that I really enjoy board work. I'm on a couple other boards as well. One of the boards I've chaired was a national nonprofit. And so, I love governance. I love the boards. And, and through just succession, I think we kind of ran out of candidates for president. And so somebody nominated me and here we are. So, but I love it. And it's been a great year. And I've just worked with some amazing physicians. And Susan D'Antoni, who's the executive director of MCMS, has been an absolute joy to work with as well.
Wonderful. So tell our viewers, the general public, what exactly is the Montgomery County Medical Society?
Yes, so Montgomery County Medical Society is a professional association for more than 1,500 physicians in Montgomery County. And these are physicians who live in Montgomery County and or practice in Montgomery County. And these are folks who are committed to improving the health of all of our citizens. And much of what we do is in concert with the state medical society, which is MedChi, and the American Medical Association to focus on legislation, regulations, cut through some of the red tape that affects patient care, and also address issues that are creating a challenging practice environment for physicians.
Very nice. Briefly tell our viewers then how the Montgomery County Medical Society serves as an advocate for Montgomery County residents.
Well, number one, Montgomery County Medical Society helps the residents indirectly by helping physicians to run our practices more effectively and by reducing barriers to care. Healthcare access has been an issue. And so at Montgomery County Medical Society, we've worked tirelessly to help our patients be able to get better access to care. We also offer a service to help residents find well-trained physicians. It's called Physician Find, as well as a new listing to help navigate clinic closures and variances of telemedicine services throughout the pandemic. Additionally, in conjunction with the State Medical Society, there's a discount prescription card program to help reduce fees that patients have to pay for prescription medications. And our physician members and their practices are involved in extensive community service throughout the county. They volunteer time, and Montgomery County Medical Society serves as the vehicle to help to organize those services. And we also have a Maryland Responds Medical Reserve Corps, where several physicians are involved in, and they're involved at the state level with MedChi and health equity initiatives to make sure that all citizens are given the same access to care.
Very, very impressive. So why do you think it's important that a physician in Montgomery County join the medical society?
Well, we know that physicians are really busy in most cases, but we feel it's really important to highlight the physicians who choose to join Montgomery County Medical Society and MedChi, because these physicians have made an extra investment in our community. And I think that's so important, because I think patients need to know how much our physicians care about our community and how much they care about our patients. These physicians live and work in Montgomery County, and they care about our patients' health status and the community. And then in this rapidly evolving environment, the offerings made available through the society really help us to become better physicians. And so I think it's a good idea for patients to encourage our physicians to be members, and don't hesitate to ask your physician if they're a member of Montgomery County Medical Society.
In what way can the medical society advocating for patients and doctors help to safeguard patient care?
That's a great question. I think one is we as physicians have our fingers on the pulse of what our patients need. And so one of the things that we can do is work with our state medical society to make sure that we're surveying the landscape and make sure that our patients are getting what they need. In Maryland, we've been quite a progressive state in terms of some of the initiatives that we've taken on. And so I think it's important to make sure that we're making sure that some of those progressive programs are working. And the only way we know that is from our patients.
Now, we, of course, are coming up with the new year to a new legislative session in Annapolis. What do you, and by extension, the Montgomery County Medical Society, view as some of the key legislative issues coming up in the next session?
Well, first of all, the legislative initiatives that we support are in concert with MedChi, the state society. And so in the upcoming legislative session, Montgomery County Medical Society worked really hard to come up with some key recommendations that will not only benefit physicians in Montgomery County, but will benefit physicians throughout the state. And so the organization is committed to working towards the timely delivery of healthcare services and fair payment for physicians. And so this has been an issue. And so this year we're really working on advocating for policies that facilitate efficient and accessible healthcare, and that includes physician payments. MedChi will strongly endorse measures aimed at protecting access to physician services and also upholding the integrity of the medical profession. Additionally, we'll champion legislative efforts to address critical aspects of behavioral health, emphasizing the importance of treatment and recovery resources. And also we'll throw our support behind initiatives that strengthen public health, recognizing the significance of proactive measures to enhance overall community well-being. And through these focused legislative endeavors, MedChi aims to contribute to a healthcare landscape that prioritizes quality, equality, accessibility, and the holistic health needs of the population.
Very impressive. You mentioned equality. That's a topic that's near and dear to my heart. Unfortunately, in Maryland, as there is throughout the country, there are racial disparities for healthcare access, and that leads in turn to poor outcomes depending on one's ethnicity. What is being done in Maryland to try to level the playing field to healthcare access?
That's a great question. Well, one of the things is we work in concert with our local health department to make sure that patients have equal access to health care. Maryland's MedChi has also been a champion for making sure that our Medicaid payment rates are on par with Medicare, which is a huge deal because we feel that patients who are on Medicaid should get the same care that those who are not on Medicaid. And so having reimbursement rates that are commensurate with Medicare was a huge win for the state of Maryland. And so there are many other things that we do. We volunteer, we advocate for primary care payment rates that guarantee sufficient access to all patients, regardless of race, ethnicity, religion, or any other factor. And so I think making sure that everyone has access is the most important thing.
I know a growing concern in the physician community statewide is non-physicians that are healthcare providers trying to expand their portfolio of services that they can render. What is the position of the state and county medical society on this emerging issue?
MedChi opposes expansions that may compromise the quality of patient care because at the end of the day, it's the quality of patient care that's most important. And now we do believe that healthcare professionals must have the appropriate training, the most appropriate education, and patient care experience before they are allowed to provide care. And, you know, there are some qualified providers. We understand that, but we also understand that in most cases, a lot of those non-physician providers really should be providing care under some direction of a physician.
So this will be a topic covered during the legislative session?
Yes. It's an ongoing topic of discussion for sure.
Okay. We're going to pause briefly for a public service announcement. More with my guest, Dr. Angela Marshall. We'll be right back.
Might not see it coming. It's prediabetes, and it captures 1 in 3 adults. You may not even know you have it, but you can escape. Take the 1-minute prediabetes risk test to know where you stand. With early diagnosis, you can change the outcome and prevent or delay type 2 diabetes. Be your own hero on smartphones everywhere at doihaveprediabetes.org.
We're back. My guest this evening is Dr. Angela Marshall, president of the Montgomery County Medical Society. Angela, let's shift gears now to discuss utilization review. And first of all, define for our viewers what exactly is utilization review, UR, and what was its original intent?
That's a great question, and it's a topic of conversation that I hear often nowadays. So utilization management refers to the evaluation and coordination of healthcare services just to make sure that they're medically necessary, cost-effective, and delivered in an appropriate setting. The primary goal is to optimize the use of healthcare resources while maintaining high quality patient care. And so utilization management is commonly employed by insurance companies because they want to make sure that they're spending their dollars in the right places. And they want to make sure that they have enough resources to go around. And so while doing that, they usually balance the need for quality care with the goal of controlling healthcare expenditures. And it usually involves a collaborative effort among healthcare professionals, payers, and patients to achieve the best possible outcomes while managing the healthcare resources responsibly. And MedChi aims to streamline policies like prior authorization and step therapy laws to reduce some of the administrative burdens on physicians and help improve patient care.
Well, that's certainly the original concept of utilization management and review. But is it your sense that there's now been a drift on behalf of some of the insurance companies to distort its purpose in an effort to maximize their profits?
Well, that's a great question because many of the insurers are for profit. And, while we understand that the health insurance companies don't have a blank check to write for each patient, and we do understand that they have to be judicious with the resources, we think in some cases the insurance companies have gone too far, and that there's a difference between managing existing resources and managing and maximizing their profits. So we want to make sure that while they're managing their resources, that the patients are not being harmed because they're not doling out the resources appropriately. And so that's where we feel that it's important to have good legislation, smart legislation that helps regulate some of that balancing act.
Let's shift gears to discuss another important topic. What exactly is the Maryland Primary Care Program?
So the Maryland Primary Care Program is what we call an alternative payment model for physicians that helps support primary care. And it essentially ensures that primary care remains integral to Maryland's overall healthcare model. Because we know that primary care has been one of few things that has really been shown to impact a person's overall health over their lifetime. And so this is one program that helps support primary care. It also helps to support one of the lowest costs of care for patients. We know that getting care in a primary care setting is about 1/10 of the cost of what insurers pay for patients to seek care in the emergency room. And so we feel that it's integral to our community to make sure that we support primary care.
A very concerning emerging topic in Maryland is the progressive decline of the physician population. Share with our viewers some of the reasons that there is a net decline in available physicians in Maryland.
Well, one thing we do understand is that our physicians in Maryland are aging, and we also have noticed a trend of physicians leaving the field, particularly after the COVID pandemic. And so that is a great concern for us. We are facing an aging workforce, and as some of our most seasoned physicians retire, there's a need to replace them. And we need to have a pipeline of younger physicians to replace those that are leaving. And so the gap between those retiring and the new physicians and the new graduates entering the workforce is what can contribute to some of these shortages. And so this imbalance can affect the overall availability of healthcare services, especially in specific areas of expertise. And so we understand and realize that not only do we need more physicians, but we need the right balance of physicians. And so one thing that we have learned is that some of the low insurance payments, in fact, Maryland physicians are paid in the lowest 10% of the country, have contributed to our inability to attract young physicians to Maryland. And so this is a concern for both the Montgomery County Medical Society and MedChi. Also, we understand that physician burnout and challenges in maintaining a healthy work-life balance can also impact the retention of the existing physicians in the profession. And so, we understand that some are aging and retiring, but we also understand that some are simply burning out and they're retiring earlier because they're tired. And so addressing these issues is crucial in order to retain experienced practitioners, and also crucial in attracting new talent.
So to be clear to our viewers, to sum it up, if you are a young physician and you have the choice of a job in Maryland and a choice in Northern Virginia, just over the river, there may be a big economic advantage to locating in Northern Virginia.
That's exactly right. And so this is exactly why Montgomery County Medical Society and MedChi is really pushing to equalize the financial playing field for physicians so that we can compete with some of these other states. Also, another trend that we're seeing is because of the payment environment in Maryland, a lot of physicians are converting their practices to concierge medicine because of the inadequate payments from insurers. And so all of these factors are contributing to a perfect storm, which is definitely affecting patient access to care.
What would you explain for our viewers, what exactly is a concierge practice?
So a concierge practice is a medical practice that charges a membership fee, usually an annual membership fee that is over and above what they get from the insurance companies. And so this is very common in primary care practices in particular, because primary care physicians have their payments have not kept up with inflation and have been inadequate to support a lot of the practices. And so the concierge physicians are charging membership fees anywhere from $1,500 a year, as high as $10,000 a year to patients so that they can secure access to their physicians.
My understanding is that there's some regulatory reasons in Maryland, maybe even antitrust reasons, why you've been unable to raise physician reimbursement in Maryland to be more akin to what's available elsewhere in the country. Why is it that those restrictions have not been lifted if they are available in other states?
That's a good question. And that's one that we have posed to our legislative friends. And it's one that we're working to address in an ongoing fashion.
Have you had any dialogue with Governor Moore about this issue? Because I'm sure he doesn't want on his watch to have a progressive exodus of physicians from the state.
I'm sure, I know that MedChi, our state agency, has worked tirelessly on this effort. One of the other issues we have is, insurers, when insurers become more than 50% of the payer environment, we tend to get in monopoly zone. And so we've got some of those issues going on as well. And so it's one thing I've learned personally is that it's a very complex issue. And it's one that we are still trying to peel back the layers to better understand what are some of the driving factors. And I think we need to study it more so that we can propose the right solutions to address it.
Billy, in Maryland, as it is elsewhere around the country, behavioral health is an emerging issue. What sort of aspects of behavioral health access are being advocated at the county and state level?
Well, for one, MedChi aims to expand crisis treatment centers to ensure appropriate responses to behavioral health crisis, and also to address current deficiencies in the behavioral health system. We're also really pushing to make sure that behavioral health is reimbursed similarly to medical care. And so these are things that we feel is really important in order to encourage, the appropriate treatment for those who need it.
What do you think will be happening in the future of private practice in Montgomery County. Do you think there'll always be a role for the solo or small group practices, or will there be progressive consolidation and corporate ownership?
Gosh, I certainly hope so. One of the things that we've seen over the years is a lot of physicians going from being independent owners to being employed. And, no dig on being employed. A lot of physicians, don't like the headache of owning their own practice, or, don't like the headaches of managing people and things like that. But one thing that we hear a lot is that a lot of physicians really miss the autonomy of private practice. And so, we want to make sure that physicians are free to have that option, and make sure that physicians aren't forced into one model or another out of desperation. And so one of the advantages that some of the hospital-based systems have is that they're able to charge facility fees even if they're not in a hospital setting. And so them being able to charge these higher fees and command a higher fee schedule, if you will, sometimes gives them a disadvantage, and makes them more able to afford higher physician salaries than physicians can make on their own in private practice. And so that's something that we're also looking at. That's not just a problem in Maryland, that's across the country. But we think that it's important for physicians to continue to have a viable option to be able to be in private practice if they so choose.
If our viewers have any questions, how can they reach you and or the Montgomery County Medical Society?
Well, they can reach the Montgomery County Medical Society at our website, Montgomery County Medical Society. And they can reach me on my website at mdforwomen.com.
Thank you for a very informative interview, Angela.
Thank you. Thanks for having me.
My thanks to Dr. Angela Marshall for an absolutely terrific interview. My thanks to the team at the station, and most important, my thanks to you, the viewer, for welcoming us into your home this evening. My next topic will be a very interesting one. I'll be inviting my colleague, Dr. Samir Shabel, who's an interventional GI endoscopist with MedStar GI Group, and he'll be discussing some of the exciting new endoscopic innovations to treat a variety of GI disorders, including GI bleeding, challenging polyps, and other challenges involving the gallbladder and bile ducts. It's going to be a very interesting show. See you then next time for another edition of Housecall. Good evening.